Sreelakshmi. I am an optometrist. Now I am pursuing PGDO and fellowship in Strabismus Management from Indian Academy of Optometry, Coimbatore. Today I am going to demonstrate how to identify squint based on direction of deviation, then cover test based on competency and position of cornea reflex. First of all, what is strabismus? Strabismus means misalignment of eye. It is a condition in which one eye is turned in a direction that's different from the other eye. In normal condition, the six muscles that control the eye movement work together. The six muscles are extraocular muscles, four rectus muscles and two oblique muscles. Four rectus muscles are superior rectus muscle, inferior rectus muscle, medial rectus muscles and lateral rectus muscles, and two oblique muscles are superior and inferior oblique muscles. In abnormal condition, that means in strabismus, muscle can't control the eye movement. Based on direction of deviation, first one is horizontal deviation, second one is vertical deviation, third one is torsional deviation. In horizontal deviation, there are two types of deviation, esodiviation and exodeviation. In esodiviation, the eye turns inward. In exodeviation, the eye turns outward. In vertical deviation, there are two types. It is hyperdeviation and hypodeviation. In hyperdeviation, the eye turns upward, and in hypodeviation, the eye turns downwards. And torsional deviations are encyclodeviation and excyclodeviation. For example, here the first picture, there is no strabismus, the eye look normal. In the second picture, the eye turn inward, so it is esotropia. In the third one, the eye turn outward, it is exotropia. And in the fourth one, the eye move upwards, it is hypertropia. And in fifth picture, the eye turn downward, it is hypertropia. Based on competency, strabismus can be committant and incomittant. With committant cases, the deviation of eye remain constant with changes in the angle of gaze. With incomittant cases, there is a change in the angle of deviation is different with position of gaze. We can test the 9 gaze position of the eye using broadest test. It is a very simple test. The test can be performed at 40 cm distance. Hold a pen torch or an object 40 cm away from the patient and ask the patient to follow the object without moving the head. Just test the visual acuity of the patient. Can you please close your left eye? Please read 0, 5, 7, 2, 4, 3, 0, 7, 5, 3, 2, 4, 3, 7, 5, 0, 7, 5, 2, 4, 3, 0, 7, 4, 3, 7, 5, 2, 0, 7. Please close your right eye. 3, 0, 5, 7, 2, 4, 3, 0, 7, 5, 3, 2, 4, 3, 7, 5, 0, 7, 5, 2, 4, 3, 0, 7, 2, 3, 7, 5, 0, 2, 7. Okay. The patients have 6 visual acuity in both eyes. Now we can perform the 9 gaze position of the eye using mirrorless test. Here I am taking the object as a pen. So while moving, please follow the tip of the pen without moving your head. This is primary position, levo version, levo elevation, levo depression, elevation, depression, dextro version, dextro elevation, dextro depression. Here the patient ocular motility is full and free in all directions of gaze. Based on corneal reflex, here I am performing Wishbrook test. It is also known as corneal light reflex test. It is a very simple test to check the ocular alignment. Instruct the patient to focus their gaze on the light source, which is directed toward the middle of the nose. Observe the corneal light reflex from both eyes. Please use the light. Here the reflection is centered in each eye So the patient have normal alignment. Degree of deviation can be roughly estimated by measuring the decentration of reflex from the center of the eye in millimeter, that means mm. 1 millimeter of deviation in reflex is equal to 15 prism. If the reflection is descended temporally from the center of pupil, it is esotropia. If the reflection is descended nasally from the center of the pupil, it is exotropia. If the reflection is upward descended from the center of the pupil, it is hypotropia. If the reflection is downward descended, it is hypertropia. We can also estimate the amount of deviation, but it is less accurate. If the corneal reflex is between the pupil and pupillary margin, it is 7 degree or 15% diameter. If the corneal reflex is in the pupillary margin, it is 15 degree or 30% diameter. If the corneal reflex is between the pupillary margin and limbus, it is 30 degree or 60% diameter. If the corneal reflex is at limbus, it is 45 degree or 90% diameter. If it is at the sclera, it is more than 45 degree. Based on cover test. First one is direct cover test. Second one is cover uncover test, and third one is alternate cover test. Cover test is performed at distance and near. Direct cover test is a very simple test which is used to determine if there is a presence of tropia or a narrow squint. To perform this test, patient is asked to focus 6-meter distant target and occlude one eye and check the movement of the other eye. Please listen. In the presence of manifest squint, the uncovered eye will move in opposite direction to take fixation. Here there is no movement, so the patient have no tropia. The second one is cover uncover test. This test is usually used to notice or determine if there is heterophoria, and it also differentiates heterophoria from heterotropia. Here I am covering the right eye and uncovering it. And with the movement of the right eye itself, there is no movement. Then left eye, covering the left eye and uncovering it. There is no movement in both eyes. Third one is alternate cover test. It is usually determined whether the squint is unilateral or alternative, and it is also differentiate concomitant squint from paralytic squint. It is important to place occluded alternatively several times to dissociate eye, and occluder should be transferred quickly from one eye to another to prevent fusion. We can perform alternate cover test. Here there is no movement. Then we can also perform for near. Before jump. In alternate cover test, there is no movement in any eye, so the patient have no squint.